Fibromyalgia can be broken down into fibro, meaning fibrous tissue, my, which refers to muscle, and algia, meaning pain. This makes perfect sense because fibromyalgia describes a well-defined syndrome of chronic widespread soft tissue pain that is non-inflammatory in nature. It's often accompanied by a variety of typical symptoms, including fatigue, sleep disturbance, and cognitive clouding. Although the pathogenesis of fibromyalgia remains poorly understood, we think it's because of something called central sensitization. This is when the central nervous system amplifies pain signals, resulting in pain hypersensitivity. This theory suggests that the primary pathology is actually in the brain and spinal cord rather than abnormalities confined to the region of the body where the person is currently experiencing pain. This theory is supported by the presence of altered levels of neurotransmitters in the cerebrospinal fluid, as well as various abnormalities on functional imaging studies performed on people with the condition. Risk factors include female sex, with FM being 5 times more common in females than men, a family history of FM, rheumatological conditions, and age between 20 and 60 years old. The clinical features of this disease includes widespread body pain, which is almost always accompanied by comorbid symptoms. Pain is typically widespread and may be experienced in both soft tissues and joints. Typically, at least 6 sites are involved with particularly sensitive spots. Patients exhibit diffuse tenderness to palpation on physical exam. Moreover, allodynia, or pain induced by normal touch, is common and can be screened for if pain is induced by inflation of a blood pressure cuff. There should be no evidence for a systemic disease process causing inflammation because the primary pathology is probably in the CNS. Comorbid symptoms often include persistent fatigue and sleep disturbances. Patients with FM characteristically sleep lightly, waking frequently during the early morning and having difficulty getting back to sleep. They're often stiff in the morning and feel unrefreshed, even if they have slept 8 to 10 hours. Cognitive clouding, known as fibrofog, is present in the majority of patients. Typically, people describe problems with attention and difficulty doing tasks that require rapid thought changes. It's not known if this is related to poor sleep or a primary manifestation of FM. Another key feature is psychiatric symptoms, with depression and/or anxiety present in 30 to 50% of patients at the time of diagnosis. Other common symptoms include headaches, paresthesias, and comorbid conditions like IBS and gastroesophageal reflux disease. It's important to recognize and ask about all the symptoms a patient might experience, because no 2 individuals are the same. The management of fibromyalgia requires a patient-specific approach with thorough patient education, lifestyle optimization, and pharmacological interventions. Referrals to specialists should be considered for both assessment and management to ensure a correct diagnosis. Key parts of education include reassuring the patient that the pain is real, but it's not caused by tissue damage, that it's not a progressive or deforming disease, symptoms might fluctuate, and that chronic pain can obviously affect the way patients feel, but doesn't necessarily suggest a psychiatric condition. Importantly, the overarching goal of management is not to achieve a completely pain-free state, but rather to enable the patient to manage their pain so it doesn't limit their function. Lifestyle management includes healthy habits and supportive care, encourage regular graded aerobic exercise, which is realistic and achievable, a balanced diet, and good sleep hygiene. Helping patients to reduce situational stresses is key. Cognitive behavioral therapy may improve pain and function, and support groups might also have some serious benefits. Pharmacological management in FM is limited and might only yield small results, but it's important to consider nevertheless. Several drugs often must be trialed and can have serious adverse side effects, which must be balanced with the symptomatic and functional benefit. Agents that have shown to reduce pain in FM include tricyclic antidepressants, gabapentinoids, and serotonin and noradrenaline reuptake inhibitors. Don't forget that management requires a holistic approach, and you should consider all 3 components to be as effective as possible. The Fibro system is an evidence-based strategy for the rapid assessment and screening of fibromyalgia. F stands for fibrofog, I for insomnia and waking up unrefreshed, B for blues, including depression and anxiety symptoms, R for rigidity or stiffness, and O for ow or generalized pain. Thanks for watching Townsend Teachings. Don't forget to like, comment, and subscribe.